Good morning, everybody. Welcome to week 6 of our 8-week part series for clinical skills. This morning, we're going to be doing bed bath and we're going to do cath care. All right, so remember, your pre-procedural skills should always be done for every skill set that you're required to do. So pre-procedural skills are always going to be knocking on the door, entering into the room, shut the door for privacy, walk towards your patient without touching anything, introduce yourself, say why you're here, make sure that it's okay to do so, and then you're going to go wash your hands. So here we go. Knock, 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 enter into the room, shut the door for privacy, walking over to the patient. Good morning, Mrs. Smith. My name is Lori. I'm your CNA today, and I thought I can help you out with your bed bath. Is that okay? It is great. I'll be right back. I need to go wash my hands first. Because this is your first skill, remember that you officially have to really wash your hands. That means with soap and water, doing it the full time, okay? And during that first skill, you're gonna get checked off on hand washing every single time that you need to wash your hands. You'll do so until the nurse tells you not to wash your hands anymore, that she's completed your check off officially, okay? All right, so over here, when we go to wash our hands, make sure that our body is not anywhere by the sink. Make sure that if you have any sleeves, to roll them up. If you have any jewelry, take it off, put it into your pocket. Leaving watches, rings, and bracelets on can cause you to fail the exam. You're going to use a paper towel to always turn the water on. So we'll turn our water on, make sure that it's nice and warm. And what we're going to do is we're going to rinse our hands without touching anything. And then we're going to use our soap pump, and we're going to pump 3 times. So 1, 2, 3. And so that's going to give us a large amount of soap there. We're going to hover over the sink without touching anything. And for 20 seconds, we're going to do nothing but scrubbing the palms, the tops of the hands, in between the fingers, around the thumbs, and around the wrist. That's what I want you to focus on for 20 seconds, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. After the 20 seconds, you're going to use your nails and you're going to scrub your palms with your nails, okay, on both sides. Then you're going to use your thumb and you're going to clean up underneath each individual nail that you have, okay, on each side. And then you're also going to use your thumb to get the cuticles clean, okay? Once you finish with all this, you're going to rinse off. And so we're going to rinse without touching anything, rinse without touching anything. We're going to dangle our fingers, okay? No flicking and no shaking. So we're going to dangle. We're going to get a brand new paper towel, shut the water off, throw that away, get a brand new paper towel, and we're going to dry our hands. So we always want to dry from the tips of the fingers down to the wrist. Once we're finished, we're going to go ahead and put that into the trash, and then we're going to come back into the room and kind of go from there. So, Mrs. Smith, I've washed my hands and everything now. Before we start, can I get your full name? Okay, great. How about your ID bracelet? Can I see that? And what about your date of birth? Okay, perfect. Let me go ahead and pull your privacy curtain shut. And then I'll be right back. I just need to go get my supplies. So at this point, this is where you would go gather up all your supplies. So we're doing bed bath here first. And so this is what we should have as far as our supply list. You need something always for the table. So if you're using the table, you have to have something on top of it. It could be a paper towel. It could be a washcloth. It could be a regular towel. It could be a Peri pad. Really, almost everything is open, but you have to have something on the table. The only time you don't put something on the table is when you're feeding a patient. We're going to have soap and lotions for the back of the patient. You need several pairs of gloves. I would say at least 3 pairs of gloves. One for the eyes, which you're going to remove after. Once to do the bed bath. And then when you're finished the bed bath, you're going to remove that pair of gloves and then put these new ones on. And that's to kind of wrap up, like putting the bed down so you can walk away from the bed. We have a bath basin for our water. I've got 3 washcloths, one for the eyes, one for washing, one for rinsing. I've got something to dry the patient. I've got a new gown for them to put on, and I've got a bath blanket that I can use. So this is not mandatory, but I teach you with the bath blanket, okay? All right, so we've got all of our supplies together. We haven't done anything with the bed, so we can feel free to walk away from it. We would take our bath basin and we're gonna go into the bathroom. We're gonna use a paper towel to turn the water on. We would fill the basin up approximately 50%, okay? Paper towel, shut the water off, bring this back in. With all water skills, you need to go ahead and test the water first before your patient gets it placed on them, okay? That is mandatory. It is a big safety checkpoint. So what we're gonna do is we're gonna put our gloves on. We're gonna peel part of the glove back like this. We're gonna dip our hand into the water, our wrist into the water, and we're gonna look at the nurse who's watching us and we're gonna say, the water is not too hot and it's not too cold. Mrs. Smith, would you like to test it? And so it's gonna be a mannequin. So the mannequin's gonna say no, and then you just continue on, okay? So the patient said no, that they didn't wanna do that. So we're gonna come on over. And I'm gonna start off by raising up the bed so I don't hurt my back. And then you can lay that patient's head down. I like to go ahead and put the bath blanket on the patient to keep them nice and warm, because we have to take their gown off. And you don't need to completely open this up. It can stay doubled up. Once that is on the patient, we're gonna take the gown off. So you're gonna untie the ties. We're gonna kind of pull this down off of the shoulders. And then we're gonna be able to slide it down the patient's arms to get it off. Remember that even though this is not a real person, the nurse is still watching how you're taking this stuff off to see if you're being too rough with the patient. Okay. Once you have this off, you can place this into your dirty clothes basket, and then you'll go ahead and kind of finish up this skill here. Okay. All right, so now we've got our bath water and everything. And we're gonna take this towel and we're gonna place this over the chest. And there is a reason for that. Get your first set of your washcloth. So this is for the eyes specifically. So there is a checkpoint that says they want to ensure that you're not putting soap in the patient's eyes. So this washcloth should have absolutely no soap on it. Also with the face, you're not to have any washing of the face as far as with soap. You have to, if you're going to use soap on the patient's face, you have to ask and get permission. So I tell you, just don't use soap at all on it, okay? So we're going to take our first washcloth, we're going to dip it in water, we're going to squeeze it all out, and we're going to go ahead and make a mitt. We're going to cleanse the patient's eyes from inner corner to outer corner. So we're going to start from inner corner to outer corner. We're going to switch position on the washcloth, and we're going to wash the other side. Now, this is done, so we can go ahead and remove this. We can remove our dirty gloves and throw those away, and we put on the second pair of gloves that we had. So these are brand new gloves, okay? Now we're gonna work on the patient's face. So again, this is the next washcloth, this is the second one. There is no soap to be placed on this, only water. So we're going to dip, squeeze out, and we're gonna go ahead and make our mitt. And we're going to wash all in one area, from basically the forehead to the chin, getting the cheeks, the bridge of the nose, up underneath the neck area and around the ears, okay? So you can do this in circular motions. So we're just gonna cleanse the face, get around the chin, get the bridge of the nose, get behind the ears, and get the neck. okay? So once we're done with that, we're gonna hang this up on the side. And then we're gonna use our towel to dry the patient's face off. So we already have the towel here, so we just need to pull it up and then just do a pat dry. Okay? All right, now we're done with the face, so we're gonna pull this down, keeping the towel on top. And so this way we never uncover the patient. So all you did was you switched from the bed bath being on the bottom to the bed bath being on the top. So now the towel is on the chest, the bath blanket is on top of that, okay? All right, so we're gonna take the same washcloth we just used, we're going to dip it, squeeze it out, and we are adding soap this time. So we're gonna add our soap, they wanna see it squishy, they wanna see suds. So we're gonna go ahead and make our mitt. And in circular motion, we're gonna cleanse the whole chest. Make sure you get the shoulder area as well. And you can get back up underneath the neck. You're gonna hang this up. You're gonna get your next washcloth. This is gonna be our wet rinse cloth, and we're going to dip, squeeze, no soap being added to this. But we're gonna make our mitt, and we're gonna go ahead and rinse everything off. Make sure you get around that neck again. And then we're done with rinsing, so now it's time to dry, but we already have the towel there, so this is the reason why I do this. So all I have to do is basically pat down on the towel, because the towel's already there. All right, so now we've done the chest, now we're gonna do the stomach area. So we're gonna pull the towel up a little bit, fold it up so I can see the stomach, and then I'm gonna fold down the bath blanket, okay? So we're gonna go ahead and get the washcloth, we're gonna dip, squeeze, you don't need to add any more soap, it's got plenty of it in there. And we're gonna go ahead and wash the stomach. We're gonna go ahead and hang this back up onto the side. We're doing this because we don't wanna get the water dirty, soapy, and cold, okay? Get your rinse cloth, dip, squeeze, no soap on this. This is only for rinsing. Circular motions. Hang back up. And then we're just gonna pull this towel down. So you see how we never expose the patient. So we're gonna pat dry. We're gonna take the bath blanket, cover the patient back up, pull the towel out. Now, for the state examination, I always get that question of, do I have to wash both arms? The answer is no. For Prometric, you only need to wash one arm, and that should be the arm that's closest to you, okay? So we're gonna take the towel and we're gonna lay this down. And we're gonna wash, rinse, and dry the arm. So Mrs. Smith, I just need to help lift up your arm. There you go. And we're gonna get our washcloth and we're gonna dip, squeeze. We should not need any more soap, but if you do, you can add it. Make your mitt. Circular motions, washing all parts of the arm. One down to the hand. And then the last piece we're gonna get is here in the armpits. Okay, hang this up. Go ahead and get your rinse cloth, dip, squeeze, make your mitt. Again, go ahead and rinse. Circular motions. Get all the way down to the hands. And then go back up and we're gonna get the armpits last. Make sure that you're being gentle with your patient. And then all we have to do is take this towel and we're gonna fold it over and we're gonna pat the patient's arm dry. Again, be very gentle with your patient. Lift up the arm, get the armpit nice and dry, put the patient's arm down. Now, we're gonna just move this towel off to the side for a second because we have to get our patient to roll over so we can start washing the back. So Mrs. Smith, we're gonna be having you roll over, okay? but I just need to check something first. This is a safe, not a safety checkpoint, but it's like an infection control checkpoint. So before you turn the patient, they want you to look at your water in your basin. They want to know, is that water cold, soapy, or dirty? And if it is, they want you to switch it out for new water. But with the way I've taught you, if you always hang everything up on the side, you should never have to change your water out. The rags sitting in the water is what helps it to get colder, soapier, and dirtier, okay? So when we hang them on the side here, that prevents that from occurring, okay? All right, so now we're gonna go ahead and say to the nurse, my water is not soapy, dirty, or cold, so I'm gonna continue on with the bed bath. So we have the patient roll to the side. So can you roll to the side for me on the count of 3? 1, 2, 3, and turn. All right, you're doing a great job there. All right, so remember, try to keep your patient all nice and covered up. Because this is a mannequin, sometimes they're hard to stay on their side. Use the mannequin's legs, bend them, and that'll be like a tripod for you. So that way it'll stay up and you won't have to worry about the mannequin consistently falling over. The next thing you need to do is take this towel and you need to lay it up against the patient's back. That is a checkpoint. They are looking for this. We're going to get our washcloth and we are going to dip it and put more soap on it. Dip, squeeze, more soap, squish it up. Wash behind the neck, the shoulders, and going all the way down the back in circular motions. You'll stop right at the top of the buttocks area. Okay? Once this is done, you can hang it off to the side, get your rinse cloth, dip, squeeze, no soap to it. You're gonna rinse everything off. And then you're gonna pat the patient dry. Now we're gonna get soap, or I'm sorry, lotion. Put the lotion into your hand, warm it up. Start at the base of the spine, going to the shoulders. Circular motions. When you get to the top, you come straight down. So what the checkpoint says is, did you apply the lotion using circular motions and long strokes? So circle, 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 long strokes down, okay? 3 times. So 1, 2, and 3. So once that lotion's been placed on the back, we're gonna go ahead and pat it dry. We can take the towel out, just lay it over here for a minute, just in case we reheat it. And we're gonna have that patient roll back onto their back. All right, how you feeling? A lot better? Good. So now at this point, we're gonna go ahead and put the gown on. All you have to do is lay the gown on top of everything. Put your hand in through the armholes. Help to guide the patient's arm into it. Do the same thing for the other side. Your hand in through the armholes. Help to guide their arm into it. When it comes to tying your gown, you do have to tie your gown. So tie it in front of the patient. Pull it around the head. Now you've got the patient's gown on. So all you have to do at this point is you're gonna start pulling down the bath blanket, and then you're gonna pull up the sheets, okay? So now at this point, this patient has been washed, rinsed, and dried. Face, neck, chest, arm, back, and then we put the lotion on, okay? So everything has been done. So now it's gonna be time to kind of wrap up everything. So this is what we call dirty to dirty and clean to clean. I've got dirty gloves on. I'm gonna touch my dirty items and get rid of them. So dirty items are gonna be any of the washcloths, the towels, the old gown, the bed bath, our bath blanket. We're gonna put these into the dirty clothes. Once that's done, now we're gonna switch out our gloves. So we're gonna take off these dirty gloves, okay? And then we're gonna put on some brand new clean ones. With the brand new clean ones, we can go ahead and put the bed down. We can get her comfortable. Would you like your head up a little bit? You do? And we're gonna cab the patient. Remember what cab means. Cab stands for call button. So here's your call button. If you need anything, just press the little red button there, okay? A stands for ask them if they're comfortable. Are you okay? Are you comfortable? Would you like a magazine or water? No. B stands for bed down. So we know that the patient is safe. We can now walk away from them. From this point, we gotta go ahead and take care of this stuff here. So I still have my soap and lotion on my table. I'll take care of that last. The first thing I need to do is address this. So we're gonna clean everything the same exact way. So we'll take this and we will go to the bathroom. Once we're in the bathroom, everything, I don't care what skill it is, you're gonna dump everything into the toilet. So here we go. So our toilet is open, we're dumping it in there. We're gonna use a clean paper towel. We're gonna turn our water on and we're gonna rinse and dump this how many times? 3 times, okay? So we rinse and we dump and we rinse and we dump and we rinse and then we dump. And then we're gonna go ahead and get our paper towel, a clean paper towel. We're gonna dry this all out, both inside and out. And then we put a new paper towel down on the countertop. We're laying our equipment down on top of it. And now it's time for us to remove our gloves and wash our hands. And again, because this would be the first skill, the nurse would have to check me off on washing my hands. So I would have to go through this all over again. So again, no rings, watches, and bracelets. Make sure that your sleeves are rolled up. You're gonna always use a paper towel to turn on and off the water. So we turn that water on. We're gonna go ahead and keep our body away from the sink. We're going to rinse, rinse, pump, 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 scrub for 20 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Then I'm gonna scrub my palms on each side. I'm gonna use my thumbs and get my cuticles cleaned on each side. And I'm gonna use my thumbnail to clean up underneath every other nail on each side, okay? There we go, get all the nails clean. We're going to rinse, rinse, dangle, remember not to touch anything. Get a new paper towel, go ahead and turn your water off and throw that away. Grab another clean paper towel, start your hand drying process. So we start from the fingertips and we work our way down, okay? All right, so we're all done with this, so we're gonna go ahead and throw that away, and we're getting our clean equipment and we're putting it back up. So what we're gonna do is we're gonna swing back by this table, pick up our soap and lotion, load it up into our basket, and then we're gonna put it away back in its bedside drawer. We're gonna take the towel off of this table because we no longer use it, so it needs to go into the dirty clothes basket. The table will go right by the patient, okay? We're gonna go ahead and double check our cabbing. You have the call bell, your bed's all the way down. Are you comfortable? Okay, great. I'm gonna open up my privacy curtain and then I'm gonna go wash my hands again. So we would have to go back and do again that 30-second hand wash where we're scrubbing everything and getting clean up underneath our nails. And that would be our finalized hand washing checkoff along with the bed bath skill, okay? So if that was your first skill, that's how that would go. All right, So the next skill that we're going to do is going to be catheter care. So let me grab my supplies and then we'll start talking about that one. Okay, so here we are with catheter care. So we're going to do catheter care. This means that they're going to have an indwelling catheter inside the mannequin. It will be a mannequin. It will not be a real person for this. And yes, like with every other skill, you have to use real water and real soap. You really are going to clean the mannequin, okay? That's where a lot of people wind up failing, is that they don't utilize the real soap and water, okay? They try to pretend. All right, so for catheter care, we're going to need something for the table because we're cleaning this patient. So I've got a towel for the table. I've got one washcloth to wash, one washcloth to rinse. I've got about 3 pairs of gloves. I need a Peri pad to clean the patient on, but I do not need to leave them on one, so I only need 1 Peri pad. I have a towel that I'm going to use to dry them off. And again, I said we have some soap here, okay? So we're going to go ahead and start getting this patient ready. I need to put the catheter in. Okay. So our patient is now ready there. All right, so pre-procedural skills, just like everything else. We're going to knock on the door. We're going to enter into the room. We're going to shut that door for privacy. And we're going to walk over to the patient, explain who we are and why we're here. Okay, so good morning, Mrs. Jones. My name is Lori. I'm your CNA today. And I thought I could help you out with catheter care today. Is that okay? It is great. I'll be right back. I have to go wash my hands first. So because this is my second skill, I no longer need to wash my hands. Because at this time, the nurse has already told me your hand washing skill has been completely checked off. From this point on, you no longer need to wash your hands, but you're going to tell me when you would wash your hands. So I would look at the nurse at this time and I would say, at this time, I know to wash my hands, and that's what I would do. So once I've washed my hands, I come back into the room and we always have to identify to make sure we have the correct patient. So I come back into the room and I ask, can you please tell me what your full name is? Great. Can I see that ID bracelet there? Uh-huh. And what about your date of birth? Perfect. I'll be right back. I need to get my supplies ready. I pull my privacy curtain shut. I come on over. I pull all my supplies. I'm going to get my first pair of gloves on so I don't forget to put them on. And I'm going to grab my basin and we're going to go into the bathroom. So again, once we're in the bathroom, paper towel, turn on the water, fill this up about 50%, paper towel, shut off the water, throw it away. Come back into the room. What do you always do with water? We're going to double check it, right? So we're going to go ahead and pull back our glove. We're going to put our wrist into the water. The wrist is one of the most sensitive areas. That's the reason why we use it. And we're going to tell the nurse the water is not too hot and it's not too cold. You have to look at the mannequin and tell the mannequin, Mrs. Jones, would you like to check the water? You don't? Okay, that's fine. And so the mannequin is obviously not going to tell you they want to check the water. And so you're going to bring your supplies over to your patient and you're going to start on catheter care. All right, so we're going to go ahead and put our bed up. You can leave your patient in a very low semi-Fowler's position. You're going to need to put a Peri pad up underneath them first before you start, because you have to make sure that the bed is not going to get wet, okay? All right, so we're gonna go ahead and roll you to the side if you don't mind. So on the count of 3, I'm gonna have you roll. 1, 2, 3, and roll. You're doing a great job there. Just let me go ahead and put this pad up underneath you. So we're gonna lay the pad down. And we try to either roll this up or fan fold it and push it up underneath the patient and then have the patient roll on back. Go ahead and roll back for me. Good. Are you comfortable? You are? Okay. Let me get your legs here. They're a little bit twisted. All right, then I'm just gonna try to find the cap or the Peri pad here and pull that out. So now we're all good. We got you on the Peri pad, okay? All right, so from this point, you can take the sheets and we're gonna pull the sheets back to expose the patient's legs, but we're not gonna pull everything to where you can see everything right away, okay? Because privacy is very important. So we're gonna have the patient to bend their legs. Bend their legs. We're gonna expose the patient's vulva area. Make sure that this is in there. And so these catheters are held in with a balloon. All right, and for the catheters, just so you're aware, catheters should go across the top of the thigh. They should always be coiled on the bed, and they should be placed on the hook should be placed on a non-movable part of the bed frame. Those are questions that you'll see on the written exam, okay? All right, so now we've got this patient ready. We're gonna start doing some catheter care. So here's where we're gonna get our first washcloth. We're going to dip, squeeze, and apply plenty of soap to get it nice and squishy. We're gonna make a mitt. We're gonna wipe down right on top of the catheter. So from top to bottom, we're gonna do one swipe down. We're gonna switch positions on this washcloth. Remake our mitt. And we're gonna cleanse around the catheter insertion site and then downward, okay? So you probably have to hold that catheter off to the side a little bit. So you're gonna wipe around and down. Switch positions again. Hold the catheter the other way, and again, wipe around and down. Switch positions. I always like to get the inner crease of the thigh. So I do one swipe there. Switch positions. Do another swipe on the other side. Switch positions, and now we're gonna clean the actual catheter. So you need to clean, at least 3 to 4 inches down. So you have to hold the catheter so it doesn't, pop out. So hold the catheter, wrap the washcloth around it, and swipe down 3 to 4 inches. So we're gonna go ahead and clean once. Hold the catheter, swipe twice. Switch positions again. Hold the catheter, swipe that third time. So they've been washed now. So we're done with this. We can actually throw this into the dirty clothes if we needed to, but I'm just gonna hang it on the side just in case I need it again. We're gonna get our next washcloth, and this is gonna be for the rinsing. So we're gonna dip, squeeze. There is no soap applied to this. We're gonna make our mitt. We're gonna wipe right down the top. So one swipe right down the top. We're gonna switch positions. We're gonna hold the catheter off to the side a little bit. We're gonna wipe around and down. We're gonna switch positions again. And you have to switch positions. These are checkoffs. Hold the catheter. We're gonna go the other way, around and down. Switch positions again. We're gonna get the interior portion of the thigh. Switch positions. We're gonna get the other thigh. And now we're gonna start cleansing the actual catheter. So hold the catheter so it does not pull out. Swipe once, switch, hold and swipe twice, switch, hold and swipe the third time, okay? So now they've been washed, they've been rinsed. Now what needs to happen? We have to dry them. So we're gonna pat dry down the top, switch, down the side, switch, down the other side. Switch again, hold the catheter, pat dry, and then we're done with the drying, okay? So now at this point, make sure Mrs. Smith stays for privacy as much as she can. From this point, we can just double check this catheter, make sure that it's going in the right direction and everything. We can go ahead and start getting rid of our dirty stuff. So dirty, dirty, and dirty. So this is all gonna go into the dirty clothes here. Now we have to address the patient. So we have to get her off of this Peri pad here that's wet. It could be wet because we've been doing a lot of washing. So we're gonna ask the patient, can you roll to the side just a little bit for me? So when they roll, you're gonna take this, roll it up, put it up underneath the patient as far as you can, roll them back onto their back, and then tell them to come the other way. And we're gonna take this out. Now we're gonna put this into the dirty clothes. All right, so I've done dirty to dirty. Now I need to do clean to clean. So I wanna straighten up my linens. I wanna go ahead and give her the call button, so on and so forth. So I'm gonna go ahead and get rid of these dirty gloves. And then I'm gonna put on my clean new ones. So these are brand new clean gloves. I can go ahead and just double check to make sure everything is coiled on the bed like it's supposed to. I'm gonna go ahead and fix my linens here. How are you feeling, Mrs. Smith? You're doing good? Okay, great. So I'm gonna give you this call button. So we're gonna cab you, okay? So here's your call button. If you need anything, you just press that little red button there and I'll be more than happy to help you. Are you comfortable? You are? Okay. Do you want a magazine or water before I step away? You don't? Okay. Just gonna make sure your bed's all the way down. So we put the bed all the way down. At this point, we can go ahead and open up our privacy curtain if we want to. We're gonna take our dirty bin with dirty water in it into the bathroom. So we'll walk back into the bathroom with this. The patient is safe. What do? Everything gets dumped where? In the toilet. So we dump this into the toilet. We're gonna get a clean paper towel, turn on the water. We're gonna rinse and dump this. How many times? 3 times. So we rinse and dump, rinse and dump, rinse and dump. We get a brand new paper towel. We start to dry this inside and out. We get another paper towel. We lay it down on top of here and put this on top of it. And this is the second skill. So at this time, you typically need to wash your hands. But what we're gonna do is we're just gonna tell the nurse, at this time, I know I need to wash my hands. So you're gonna remove your gloves. You would tell the nurse that you washed your hands, paper towel, turn off the water, grab your clean equipment and bring it back up. Grab your soap. Put your table close to your patient, take off the towel. Make sure that the patient is still good. So you've got your call button, your bed is all the way down, and are you comfortable? You wouldn't like a magazine or water or anything? No? Okay, just wanna be sure. All right, my privacy curtain is already opened, and my last couple of things are gonna be to say, I wash my hands because I'm done, and then skill complete, okay? All right, so that is going to end today's session. Sorry, everybody. All right. And so I will talk to you guys next week. Have a great weekend.